Hi, everybody. Hi, Vishal. Hi, everybody. So, welcome today in a new episode of our live streams for BEqualise. You know me already. I'm Vivian, the founder of BEqualise, and together I'm here together with Dr. Vishal Pawar. Welcome. Hi, Vishal.
Hi,
So,
hello everyone.
Hi. So Dr. Vishal is actually also part of BEqualise, and we are extremely delighted and happy to have him on board. Just to give you a brief introduction, Vishal is a neurologist, but he also has a huge expertise on neurotology and vestibular disorders. And this is why now it's been almost a year that he joined BEqualise. And yeah, we're very happy. And today we will let everybody knows more about him and his job. And then we're going to dive into the topic of PPPD. So before we start, Vishal, would you mind just to give us a brief introduction about yourself, who you are, your studies, your interested, and a little bit about your experiences?
Yeah. So first of all, thank you, Viviana, for making me this part of this podcast. And so I'm Dr. Vishal Pawar. I'm a specialist neurologist. I did my graduation in India, and during my neurology residency, I developed a keen interest in managing vertigo and vestibular disorders because I presented one seminar where I spoke about vertigo and the various treatment modalities, and which my mentor really liked it, and he started referring his cases to me on a daily basis. And from last 15 years, like that was in 2009, I'm having keen interest in vestibular disorders. So after completion of my neurology training, I did various specialized courses in vestibular disorders, and so I have been actively practicing in vertigo from last 5 years with specialized equipments at Astor Specialty Clinic, Discovery Gardens in Dubai. I'm also participating in various academic and research activities, and I have keen interest in giving a holistic care to patients suffering from vestibular disorder, because patients with vertigo and balance disorder undergo a very reduced quality of life, and they need help. They need holistic care. That is the motto of BEqualise. So with that interest, we are, me, Viviana, and the whole BEqualise team, we are trying to help the patients who are suffering from vestibular disorders.
Great, thank you. Okay, fantastic. So I know you have huge experience because you've seen so many patients, and today we're going to talk about something that, if you're not in the vestibular field or in the neurology field, a lot of people don't know about this condition, but it's actually quite prevalent, which is PPPD. So, as you know, PPPD stands for persistent postural-perceptual dizziness, and it's a kind of an umbrella. Now, I would like to hear from you a little bit how you define PPPD, just because, in research, this has been an ongoing discussion forever. Is it really PPPD? Is it not? But what matters for the patients that are following us today is more to give you an understanding when you get this label, because the diagnosis is just really a label to just help us, basically helps more the physicians and the healthcare provider to understand what you have. But what is really PPD? So if you want to just give a brief introduction about this, and then we'll dive into the topic.
Yeah. So to simplify, what is triple PD? Like, I would like to first bring attention to how we divide the disorders. Like in general, all the disorders in medical field, they are divided into three parts. The first type of disorder is organic disorder, means there is some organ dysfunction, cellular at level or at structural level, and that leads to disorder that we call it organic or structural or cellular disorder. Then there is another type of disorder, that is psychiatric disorders. Like this is disorder which is because of disorder in the mind. It leads to psychiatric conditions. Unfortunately, the third type of disorder, these are the functional disorders. They were earlier as a part of psychiatric disorders, and even now in 21st century, it is still considered as a part of psychiatric disorder. But it is functional disorders are a third different group of disorders where the function of the organ has changed. It is not functioning in the same way it is supposed to function because of some conditions or some acute event. So, and the triple PD comes under this functional category of disorders, where it is a functional neurovestibular disorder, and this term has been coined in 2016. And if we look at the history of this disorder, it has been named differently at different times. It was first described in 1860 as vertigo in plaza, and subsequently the terms have the
So
different
many,
terminology have been given.
depending also on the group, chronic subjective dizziness.
Yes, space motion
Oh,
discomfort,
there's too
phobic
many.
postural vertigo, yeah, space motion discomfort. So variety of terms have been used, but Barani Society came up with a an umbrella term, that is triple PD. So I will explain what is triple PD. So there are four words in this. The first P, that is persistent, means the symptoms are ongoing for more than 3 months, and on a daily basis the patient might be suffering more than 15 days in a month, and the symptoms are fluctuating, not all the time. They might get aggravated at some point of time. That is first P. Then second P stands for postural. That means the symptoms are more in upright posture. When they are standing, walking, the symptoms are more felt. The patients feel better when they lie down. So that is about the postural. The third
Mhm.
is perceptual. The third P stands for perceptual component. That means the patient's perception of balance has changed. They are fearful about their balance, and they are no more believing their vestibular system for the balance, and they are more believing into two other systems, that is position system and the visual system for the balance. And
Mhm.
whenever there is any compromise in the visual field, like for example they visit open places, crowded places, or malls or supermarkets, then the system
Yes.
decompensates because they are more relying on this system. So, and the fourth, later, that D stands for dizziness, means they don't feel actual spinning, but they feel unsteadiness, imbalance of gait. So this is a functional neurovestibular disorder, which these are the symptoms of
Mhm.
these disorders. Yeah.
Yeah, perfect. Okay. Now, a lot of the patients sometimes I see that they wonder, I have PPD or do I have MDDS? So this is very interesting that we try to point it out. So PPD, the way it starts, it's very different than MDDS, the motion triggered MDDS. This is the first distinguish point, right? So PPD sometimes can arise after they also have another vestibular problem, right? So somebody may have a peripheral vestibular problem, and then down the years they develop PPD. But what other condition could a patient develop PPD? It could just come spontaneously, idiopathic, right? Is there anything else that they need to be aware of?
Yes. So if we look at the natural history of how it begins, the triple PD begins, there are three patterns with which it can begin. So the first common pattern is it starts after acute vestibular insult. Like suppose, for example, a patient gets vestibular neuritis, an attack of neuritis, and if the patient develops severe anxiety and body vigilance, then these patients, the actual disorder starts settling down, and they start developing the symptoms of triple PD. That is the first pattern. The second pattern is after an episodic vestibular disorder. For example, patient gets repeated episodes of BPPV or vestibular migraine, and then initially these are episodic symptoms, and then they get triple PD symptoms in an episodic manner, like
Mhm.
symptoms of triple PD happening for some time, then they are getting better, sometime then they are getting better, and then it evolves into a persistent pattern. If their fear and body vigilance is not taken care of, then they develop persistent pattern. And the third pattern is insidious onset, gradually progressive without any actual insult. Like you cannot find an actual insult. And Vivi, you were talking about which disorders precipitate. So if we look at the precipitating disorder, most commonly there is a vestibular disorder. It can precipitate whether it is acute,
Yeah,
chronic, or episodic vestibular disorder.
sure.
But in my practice, I have seen there are certain medical conditions also can trigger triple PD. There are for example, I have seen patients with epilepsy have developing symptoms of triple PD symptoms, patients with some other conditions like stroke developing into triple PD. So it's not like it is restricted to vestibular disorders. Some
Yeah,
non-vestibular conditions
yeah.
can
Also
precipitate.
dysautonomia as well. Yeah,
Yeah,
definitely. Okay, so now we learn more about PPD. If you have a PPD and you're a patient and you're wondering, do I have PPD on MDDS? Another thing that is important to strengthen, just what mentioned before Dr. Vishal, is like, if you have PPD, you always feel better when you're actually laid down. And this is not the case for MDDS. This is another massive difference between the two disorders. Just to clarify, because a lot of the patients, they get this confusion, let's say. Now, if you have a patient with PPD, what will be something that you want them to know to better understand the pathophysiology without using and going too much into the medical terms, but just for them to really grasp what's going on with them, because it's complex. It's complex even if you are in the medical field. So maybe we can kind of trying to explain it in simple terms for them.
yeah, yeah. So in simple terms, if I had to explain, like for example, for a balance, if we for balance, normal balance, we need three systems. One is vision. You should be oriented with the surrounding. That is one. Second thing is, even if I close my eyes, I know the position of my hands, position of my legs, how I am sitting. So that is position sense. And the third system which we need for the balance is which is located in the inner ear, that is the semicircular canals and the otolith organs, which is connected with the brain. So in like simple terms, these are the three systems. So what happens in patients with if we look at the pathophysiology, the patients are more relying on the vision and they're more relying on the position sense than the vestibular system for their balance. So there is a recalibration in these patients of these sensations. Like recalibration means they are like for example, if we look at all the people, like we don't walk, we have the same neuroanatomical structures, but we don't walk the same way. The pattern of our walking is different. So functionally we are different. The way we write is different, but we have the same structure. Similarly, in patients with triple PD, the balance system is recalibrated, and they are trying to do the same balance function in a different way, which gets compromised in certain situations. So they have situational symptoms. So patients will have challenges in certain situations where their vision gets compromised, their position sense get compromised, they will have challenges. So where are these challenges? When they visit, as I already told, when they visit open places, crowded places where their vision is not, the in your home you can see a corners, you can see a typical, the visual orientation is clear, but when the visual orientation is not clear, the symptoms will become more apparent. And I hope I try to clarify the pathophysiology in the simple
Yes,
terms.
that's very clear. Yes, this is because, as mentioned also in our other podcast we did with Faisal, we always say between the ears there is the brain, and the brain is kind of like taking all this information and integrate them into a multisensory dimension. So whenever this integration is not occurring properly, that's when you have the problem. And as you mentioned, they become very visually dependent and relying so much on the vision that whenever they have a visual stimuli, they get dizzy. So in terms of treatment, this is another key point, because a lot of PPD patients, they are so frustrated, not only because, as you mentioned, they get triggered in certain situations, but also because there are unfortunately so many healthcare professionals that are not fully aware or what is even PPD. So again, we always tell everybody, if you download the app, even if you do not have a diagnosis, but you suspect you may have, or you just have cross and chronic dizziness, you can find all our specialists in BEqualise by going to find the nearest doctors to you, so that you get the real medical care that you deserve. So in terms of treatment, what would be the best approach according to your practice and the guidelines and what you've learned over the years for helping PPD patients?
Yeah, so looking at in my experience, like in last 5 years, I have treated around, like if we look at the patients suffering from vertigo and dizziness, I have treated around 3,200 patients, out of which the diagnosis of triple PD, almost like around 400 patients received this diagnosis. And in my experience, there are three modalities of treatment which work the best. The first is the counseling. The most important thing about this disorder is respecting about the patient's diagnosis and telling them that this is a genuine condition. Because what happens in patients with triple PD, the reports are normal. Most of the investigation they undergo is normal, and they are labeled by many like physicians or doctors as suffering from psychiatric. They are, it is all in your brain and something like that, and they are truly suffering on a daily basis. So it's very important to acknowledge. The first important step in the treatment is acknowledge their diagnosis, acknowledge their suffering, tell them it is a genuine condition, you are not malingering, and they are not, they have genuine symptoms. So that is a very important step which develops a connect between the patient and the physician. That is one. Then the counseling is plays a very important role. The first part of the treatment is the major part, that is counseling. There is a type of treatment called as cognitive behavioral therapy, which can be given by a psychologist, and it plays a very important role in patients with triple PD, apart from the other two modalities of treatment. Coming to the second modality of treatment is vestibular rehabilitation therapy. And we will also tell you about the role of vestibular rehabilitation therapy in patients with triple PD. There are exercises which help these patients. There are exercises to coordinate between the eyes, body, and the visual system. We have to recalibrate again whatever the change in their calibration has happened. We have to give them rehabilitation exercises. That is the second modality of treatment. And the
Yes.
third modality of treatment is in terms of medications. There are two parts in the medication. The first part is it's very important to treat the underlying disorder which has triggered the triple PD. For example, if a patient is suffering from vestibular migraine and develops this triple PD, it's very important that they receive treatment for that, because with every episode of vestibular migraine, their triple PD is going to get worse and worse. So that is in terms of medicines, the treatment of the underlying comorbid disorder. And the second part is there is a role of medications like selective serotonin reuptake inhibitors and tricyclic antidepressants for short time, until the cognitive behavioral therapy and vestibular rehabilitation therapy kicks in. It's
Yeah.
very important that for some period of time they should receive, so that they can, the treatment gets kicked off. Like it has a role, almost 60 to 70% improvement happens alone with the medications. And
Mhm.
until that time, if the patient start receiving the vestibular rehab, cognitive behavioral therapy, which has a enduring effect. It takes little long time to come into action. So till
Sure.
that time, the medicines can kick off the treatment and it will help them.
Mm-hmm. Okay, just to clarify, in our app, because we are so into the holistic approach and we want to promote this integration of working on many different systems, we also divide a PPD from the visual induced dizziness. So back, because we talked about classifications before, so if you are a patient that have PPD, you may have visual induced dizziness. Visual induced dizziness is what Dr. Vishal described before as having dizziness whenever exposed to busy visual stimuli, which could be going to the cinema, looking at a busy traffic intersections, or going into a mall. Whenever you have a lot of people, a lot of cues, you might get this visual induced dizziness. So if you have visual induced dizziness and PPPD, our advice on the app is first go on the visual-induced dizziness diagnosis and do that type of protocol of kind of like helping you to regain the balance on that side. Another questions that I've always asked are focusing a bit on the medications. Why? Because so many patients are afraid. They think, oh my God, I'm getting antidepressants. I don't want to take them. I'm not depressed. Or yes, I feel bad, but why do you give me an antidepressant? And if I have vestibular migraine, why do I need that? This is something that I really want to emphasize with you, because I think so many people get this wrong, and it's very important to explain to them why this is really important, and they follow them also the pharmaceutical treatment. So in terms of why do you think they need the antidepressant? Because they don't understand, why do I need an antidepressant if I have vestibular migraine?
Yeah. So if we look at the brain, serves several functions, and every function needs a connection between neurons, two neurons, and there is one chemical which is released for the communication between the neurons. For every function, there are different chemicals. So these chemicals are nothing but neurotransmitters. And there is a very important neurotransmitter called as serotonin, which is not only required for our normal mood and motivation, even the balance controlling like structures, that is, we call it as central vestibular structures or central vestibular system. The neurotransmitter, the chemical which is needed for this normal functioning of this balance control, is also serotonin. So whenever a person has symptoms of triple PD, and a patient is even suppose SSRI, it is not, patient may or may not be having depression. But the patient is given actually to improve the balance, like to improve the communication between the neurons which are trying to control the balance. So if a person receives this same medicine for different, actually he is receiving the medicine for a different purpose, not for the depression. So labeling them as antidepressant would not be appropriate. And even in patients with migraine, they have serotonin. There is a role of serotonin neurotransmitter, and that's why one of the treatment modality of migraine is antidepressants. But I don't give it to all patients. I judge the patients. I take the patients, if they have associated depression, then only they should receive it. I will give you one example which you will understand. For example, a patient of migraine, suppose, is given one medicine called as beta blocker, and the same medicine is given for patients with hypertension also. So there are two different purposes. In a patient with hypertension, it is given at higher doses for in the same medicine, but it is given in migraine to control the attacks of headache. So similarly, these medicines are given in patients with triple PD for control of balance, and it may or may not necessarily be for depression. If they have associated depression, it will improve. If they don't have associated depression, it is not for the depression. So that stigma associated with medication should be, and I have seen several patients improving on medications, they do improve with the medication.
We do improve it, yeah, exactly. So in our holistic approach, we're not against the medications. We're actually pro the medication and everything else that goes around. So other things that really works for visual-induced dizziness and PPPD, as mentioned before, are exercises. Particularly, we have integrated in the apps a couple of exercises related to ocular motor training, so that the patients can actually become and increase his ability and tolerance for visual stimuli. And the other big role will be also lifestyle and nutrition and lifestyle in general. So I know that you are a big fan of the lifestyle changes because you see the positive effect from it. So maybe just to give a quick tips, what could we give to these patients, to anybody that suffer from PPD or associated also vestibular migraine and other comorbidity, the key lifestyle changes that in your opinion will be very beneficial for them?
So the key lifestyle change, what they can bring is in terms of their stress relaxation, incorporating physical activity into their life, and the third is nutrition. Like as Vivi said, said. So these three aspects, if they on a day-to-day basis, they are more engaged into physical activity rather than restricting their activity. That is one. Second is they give very like the importance to this stress relaxation, like and mindfulness, yoga, meditation. These more this the second aspect, and the third is nutrition. And one very good example, like I would like to tell about one of my patients who used BEqualise. I was treating her for several months, and when she started using BEqualise, she saw one of the video by Vivi, and within 3 days, she was having head motion induced dizziness, and she did the exercises, and within 3 days she got the result. Her the head motion induced dizziness by doing her exercises, it was better. So that is the role of exercises. So it's very important that we, a holistic approach is we use this holistic approach for the patient, where you use all the modalities of treatment, and through this Equalize app we are trying to have holistic care of these patients.
Sure. That's exactly what we're pushing. Like we're trying to have an application that in the future is going to become even better, because as mentioned, this is our first version, but we want to really have like you have your personal, like a small Vishal into your pocket that tells you what to do every day. This is kind of the role, because I believe people need guidance. And you touched on a very important point, which is fear. So one of the biggest challenge with PPD patients especially is that they develop phobias and fears. And I always try, as you said as well, to let them understand that these fears are absolutely normal, because they lose a sense of space. You lose orientation, you lose a primary sense of where you stand, you lose your sense of control. So it's normal that, of course, your stress system is also triggered, and then that you develop fear and phobias in movements. But it is really important to try to overcome this fear, because after moving more, it's just like a visit circle. They want to move less, and then they get worse. Whenever they move, then they get triggered again. So we need to reverse the cycle. The more you move, the better you're going to feel, and the more you're going to be rehabilitated back to life, right? So the last few things, and then we were going to wrap up with two questions. I just want to, from your perspective, how would be like, because this is a question I get asked a lot. A lot of the patients, they wonder, would I live with this for the rest of my life? This is one of that they always asks, is this going to be forever? So what will be, in your opinion, something that we can always reassure? That one thing you mentioned is mindfulness, and this is very important, right? But what is a good answer also for these patients to kind of reassure them?
Yeah. So if we look at the natural history of these triple PD symptoms, uh, they are when the patients are having symptoms, and when their original disorder which triggers the triple PD that becomes worse, then even the triple PD symptoms also worsen. So, it's very important, as I already told, to treat the underlying disorder which triggers all the comorbid disorder, not only the that underlying disorder. And usually, like worldwide, it is observation that vestibular migraine is one of the most common trigger for triple PD. So it's very important that vestibular migraine is treated by lifestyle modifications, treated by preventive medications, and treatment of the acute attack. So that is first part. Then the second part of this natural history, if we want to, that's what even daily I see patients, and they are also having the same questions, like, do I have to be on medication or this therapy or rest of the life? But I have seen patients who are highly motivated for the treatment of triple PD, and they have followed all the arms of treatment, the vestibular rehabilitation, cognitive behavioral therapy, followed the nutritional aspects of treatment, and mindfulness and medication initially. I have seen patients coming out of this disorder. Of course, their underlying disorder, once it comes back, and they can have recurrence of symptoms. But many patients I have seen not needing the medication on a daily basis if they continue their lifestyle, in terms of mindfulness, physical activity, vestibular rehab exercises, if they keep doing it. And once they realize two important, I tell three important rules to the patient. That is, first important rule for this patient is, don't create undue anxiety and fear about any issue, even if they get symptoms of vertigo because of their
Yeah,
original disorder. The most important thing is, don't create any undue anxiety and fear.
sure.
Keep that episode, only that episode, don't carry it. That is one. Second is, keep moving. If you stop moving, it will stay with you. If you move, you will improve. That is second rule I tell. And the third rule I tell them is, please believe me. Like I tell to every patient, like, please believe me, I will make
Yes.
you, take you out of this situation. So it's very important to have a trust. If
Yeah,
you have trust with the patient, then it can. I have seen several patients coming out of this disorder. Yeah.
sure. Yeah, indeed. And the most important thing that we also try to promote with BEqualise, we have a huge sections on mindfulness, because whenever you're living with a chronic condition and you feel like, okay, I am out of my power, I cannot really do anything with it, mindfulness can help you, because you can just shift the way you look at things, and you can at least regain a sense of control of your life here and in the now. So we really try to promote that as well. And there are so many studies now, thanks to fMRI, coming out and showing the power of meditations and of mindfulness, also on changing functionally, as we mentioned before, our neurostructures. So this is extremely important. Okay, we have two questions, I guess, that I've read from patients. I think they're coming. Okay, hi, I'm Jane. What is the main lifestyle change I can do? Okay, we kind of mentioned it before. Maybe if you want to summarize it again one more time for them.
Yeah, in terms of lifestyle changes, first thing is mindfulness, as Vivi was telling. Second is keep moving. That is, like, learn the vestibular rehabilitation exercises, and if you keep doing it on a daily basis, it will keep your health of the balance control in check. And the third is nutrition. It's very important to give importance to nutrition in terms of magnesium, vitamin B12, omega-3 fatty acids. There are several nutritional supplements which help in the balance control. And the fourth is taking care of your underlying, like, triggers. You have to identify the triggers and get it desensitized from the triggers by slow exposure to them, and treat the underlying disorder also. That is very important. Yeah.
Yeah. When we, just to maybe clarify for everybody, when we talk about desensitize yourself from the trigger, an example, a very practical one I always used to give during my research on visually induced dizziness, a protocol to the patients. It's a behavioral protocol. We'll tell them, go out. Day one, you go in a small shop and you get triggered. Okay. After a few days, you go in a bigger shop in a mall and you get triggered. Then you go to anything like exponentially, slowly, gradually. You move on into what really, really before was unsustainable. And after a few weeks of being there, maybe for 30 seconds, then 1 minute, then 2 minutes, you get desensitized. That's what we mean with desensitization. Okay, thank you so much, Vishal. I guess we have one more question and then we wrap up. Let's see. Yes, can PPPD improve over time? Okay, yeah, that's kind of what we answered before. So I guess the answer is yes, but you have to do the work. You cannot just, there is no magic solution, unfortunately, right? What would you say it's a time period for the patients to improve, a time frame when they start to come to see you and when they get better?
Yeah. So, like in my experience, the patients, when we start once I diagnose them, I start them on all these modalities: nutritional aspect, vestibular rehab, cognitive behavioral therapy, and the medications also. I see that once they come for follow-up after a month, many patients telling almost 70 to 80% improvement in their symptoms. Like, if they follow all the, and I tell them, as four tires of in a car, there are four tires. You can't run the car, one tire without one tire. Like, so I tell them that you have to, give importance to all the four tiers, that is medications, rehab, the nutrition, and the cognitive behavioral therapy, that is with the psychologist. So all these modalities work in tandem, and they work together synergistically, and the symptoms start improving. They, as early as within a week, the patients start feeling better as compared to the previous day. Every day they get improvement, and it reaches, some patients almost achieve 100% improvement, and many patients are maintained at 90 to 95% improvement. And so that is how it is. Like they are like patients do improve. Like it's not
Sure.
like something which is not treatable. And so there is a lot of hopelessness about this disorder. It is not treatable and all. So it's very important to like we would like to emphasize through this particular activity that it's a treatable disorder and it needs a holistic approach. That is, yeah.
Yeah, it's one of those chronic and functional. The best way, if you want to get rid of it, as you mentioned, is to try to look at all aspects and to not underestimate also the stress components, because sometimes in our busy life we don't really pay attention to this. It's really, really, really important that we look. We're not, we're humans. We're made of many aspects, not just one. Okay, Vishal, it's been a true pleasure. I really want to thank you. I am so excited that you are part of BEqualise and that we have so many more things that we're building together. So thank you so much for your time. And if any patients want to reach out to Vishal directly, you can find this information on BEqualise. It's also present in the app. And yeah, just get in touch, follow us on Instagram and Facebook, and hopefully you will get better and better by using the app as well. Thank you so much, Vishal.
Yeah, thank you so much.
Thank you. Bye bye. Thank you.